So in this video, I want to talk about the association between personality disorders and childhood trauma. I'm not yet declaring that personality disorders are not making sense. All I'm sharing is last 2 to 3 decades research is highlighting that childhood trauma plays a very strong role in influencing the increased risk for personality disorders. And I'm going to talk through a couple of examples to drive home the point with references. Therefore, what we need to do is understand that personality disorder is an outcome of something else that needs to be probed. When that exposure to childhood trauma increases, the personality disorder increases. First, personality disorders are inconsistent and inflexible behaviors, I'm generalizing it, compared to the cultural norms. And therefore, some of these are also called character traits, which is not right. These are manifestations of certain experiences. And therefore, again, repeating that consistently, that we need to focus on what happened to them, individuals who come with such problems, as compared to what's wrong with you. This is a very important distinction that is beginning to happen if you look at scientific evidence versus just the compulsion to study personality disorder. One of such examples is narcissistic personality disorder. And I'm not a big expert on narcissism, and therefore I'm going to read through it. Narcissism is characterized by inflated self-worth, entitlement, and preoccupation with self. However, the research suggests that these are outcomes of exposure to trauma. Specifically, these individuals are likely to protect their extremely low self-esteem, suppress fear, toxic shame, and therefore the exaggerated behavior is what manifests as narcissistic personality. And therefore, in our daily work, we never focus on presenting problems of narcissism. We understand what happened to them, identify their timeline, exposure to trauma, the frequency, and once we understand that, we focus on traumatic events, and then the behavioral change can easily happen. So therefore, the modern research is clearly identifying that spending energy, time, and money on assessing narcissistic personality and discussing it is actually waste. And the question to ask is, what happened to them? This is about narcissism. Second such personality disorder that is talked very often is BPD, or borderline personality disorder. Now, borderline personality disorder has some unique conditions that should be given attention. Examples include their aggression and therefore high risk of self-harm or suicide behavior that includes suicidal thoughts or possible attempt. Second, they are marked by high levels of depression. So often it overlaps with major depressive disorder or a very high level of depression. Third, they also feel a strong sense of abandonment, and therefore that manifests in the personality disorder, as we call it, as BPD. All of these are unique differentiating factors in BPD. Again, the focus is not the character issue or personality issue. The focus should be on what experiences they have gone through. And we were surprised to find out similarities consistent with the literature that BPD has an overlap with complex trauma, post-traumatic stress disorder, also some components of major depressive disorder. And therefore, it is not just an end, it's an in-process assessment of what can happen to people exposed to trauma. Some manifest as NPD, narcissism, some as BPD, some may have post-traumatic stress disorder, some may have major depressive disorder, some may have complex trauma, and all of these situations have an overlap. And spending again time, energy, and money on finding the overlap in our experience is not effective. And therefore, to recap, personality disorders, the way we see them is changing, and the focus is shifting towards understanding exposure to childhood trauma. So next time when you have people talking narcissism, BPD, and all of that, please recognize that we are only looking at wrong or improper accusation on their personality, and this is a strong word. The real focus should be on what happened to them.